just got a report that the first patient has been admitted into the hospital for pertussis, also known as the whooping cough. Let's go live now to see if we can interview the first new patient. I'm Kendra, and this is my co-host.
Good morning, Kathleen.
And recently, Kathleen, as you notice, we've had an outbreak in our town with pertussis. So we'd like to start this segment off talking about pertussis and what it is. Pertussis is a respiratory illness commonly known as whooping cough. It's a very contagious disease caused by a type of bacteria called Bordetella pertussis. Pertussis is found only in humans and is spread from person to person. People with pertussis usually spread the disease by coughing or sneezing while in close contact with others, who then breathe the pertussis bacteria. Many infants who get pertussis are infected by older siblings, parents, or caregivers who might not even know that they have the disease. The symptoms of pertussis can usually develop within 7 to 10 days after being exposed, but sometimes not as long as 6 weeks.
Pertussis causes severe coughing spells, vomiting, and disturbed sleep. It can lead to weight loss, incontinence, rib fractures, and passing out from violent coughing. Although you are often exhausted after a coughing fit, you usually appear fairly well in between. Coughing fits generally become more common and severe as the illness continues and can occur more often at nighttime. The illness can be milder, and the typical whoop is absent in children, teens, and adults who have been vaccinated. This is Dr. Noodles, and I'm going to be interviewing her on pertussis. So my first question is, are most coughs pertussis, and does everyone with pertussis whoop?
Well, there are a lot of causes behind a person coughs, and not every cause is pertussis. In general, pertussis starts with a cold-like symptom, and it may be a mild cold, cough, or fever. But after 1 to 2 weeks, the severe coughing begins, and unlike a common cold, pertussis can become a series of coughing that continues for weeks. And the best way to know is to go to your doctor and have him diagnose you. And if it's the case as pertussis, he can prescribe antibiotics if needed. And then the whooping cough, it comes from a sound of people more gasping for air when they're coughing. This is what pertussis cough sounds like. It sounds like a gasping of air when the patient is coughing. However, not everyone with pertussis will cough, and many who cough will not whoop. Teens and adults, especially those haven't been vaccinated, may have prolonged cough that keeps them up at night. Those that do get the coughing, they say that it's the worst cough they ever had in their lives. And the cough may last for weeks or months, causing major disruption to daily life. Complication, for example, it can even have broken ribs or ruptured blood vessels. Infants may not cough at all. Instead, they may have life-threatening pauses in breathing or struggle to breathe. Anytime someone is struggling to breathe, get them to the doctor right away.
How contagious is pertussis?
Pertussis spreads easily from person to person through coughing and sneezing. A person with pertussis can infect up to 12 to 15 other people. That's why being up to date with the pertussis vaccine and practicing good cough etiquette are so important.
Cover your mouth and nose with a tissue when you cough or sneeze or sneeze into your upper sleeve, not your hands. Then throw your tissue in the garbage.
Many infants who get pertussis are infected by older siblings, parents, or caregivers who might not know they have the disease. If pertussis is circulating in the community, there's a chance that not even a fully vaccinated person of any age can catch this very contagious disease. But if you have been vaccinated, your infection is usually less severe. If you or your child develops a cold that includes a severe cough or a cough that lasts a long time, it may be pertussis. The best way to know is to contact your doctor.
Why are reported cases of pertussis increasing?
Well, since the early 1980s, there has been an overall trend of an increased report in pertussis cases. Pertussis is naturally cyclic in nature, with peaks in disease over 3 to 5 years. But for the past 20 to 30 years, we've seen a peaks getting higher and overall cases counts going up. There are several reasons that help explain why are we seeing more cases as of late. Those include
increased awareness, improved diagnostic tests, better reporting, more circulation of bacteria, and waning immunity.
many infants who get pertussis are infected by older sibling, parents, or caregivers who might not know they have the disease. If pertussis is circulating in the community, there's a chance that not even a fully vaccinated person of any age can catch this very contagious disease. But if you have been vaccinated, your infection is usually less severe. If you or your child develops a cold that includes a severe cough or a cough that lasts a long time, it may be pertussis. The best way to know is to contact your doctor. So when it comes to waning immunity, it seems that pertussis vaccine we use now may not protect as long as the wholesale vaccine that we used to use. Throughout the 1990s, the United States switched from using the DTP to using the DTaP for infants and children.
Pertussis bacteria changing and causing an increase in pertussis cases.
CDC is evaluating potential causes of increasing rates of pertussis, including changes in disease-causing bacteria, types, strains. Unlike foodborne illnesses, where one strain causes an outbreak, multiple types of strains of pertussis bacteria can be found causing disease at a given time, including during outbreaks. There is a lot of diversity in strain causing pertussis in the U.S. and while strains have changed over time, strain changes do not seem to be the cause of the increases of pertussis we've seen. And there is no direct evidence that strain changes have reduced the effectiveness of the vaccine. It's more likely that waning immunity is the driving force behind the increase in cases.
I've heard about parents refusing to get their children vaccinated and travelers to the U.S. spreading disease. Are they to blame for the pertussis outbreaks?
Even though children who haven't received DTaP vaccines are at least 8 times more likely to get pertussis than children who have received of all the recommended doses of the DTaP, they are not driving force behind the large-scale outbreaks or epidemics. However, their parents are putting them at greater risk of getting the serious pertussis infections and then possibly spreading it to other family or community members.
Pertussis can be prevented with vaccines?
Yes, pertussis or the whooping cough can be prevented with vaccines. Before pertussis vaccine became widely available in the 1940s, about 200,000 children got sick with each year in the U.S. and about 9,000 died as a result of the infection. Now we see about 10,000 to 40,000 cases reported each year, and unfortunately about 10 to 20 deaths. Pertussis vaccines are recommended for people of all ages. Infants and children should get 5 doses of the DTaP for maximum protection. A dose is given at 2, 4, and 6 months, and at 15 to 18 months, and again at 4 through 6 years. A booster dose of the DTaP is given to preteens at 11 and 12 years of the age. And any adolescents and adults who didn't get the DTaP as a preteen should get 1 dose. Getting the DTaP is especially important for pregnant women. It is also important that those who care for infants are up to date with the pertussis vaccination. You can get a DTaP booster dose no matter when you got your last regular tetanus boosters shot. And also you need to get the DTaP even if you were vaccinated as a child or have been sick with the pertussis in the past.
So focus on protecting infants from pertussis.
Infants are at the greatest risk for getting pertussis and they're having the most severe complications from it, including death. About half of the infants younger than 1 year old who get pertussis are hospitalized, and 1 or 2 in 100 hospitalized infants die. And there are 2 strategies to protect infants until they're old enough to receive vaccines and build their immunity against this disease. First, vaccinate pregnant women with the Tdap during each pregnancy, preferably 27 to 36 weeks. Second, make sure everyone around the infant is immunized. This includes parents, siblings, grandparents, and other family members, and babysitters. Those two strategies should reduce infection for infants. It is also critical that healthcare professionals are up to date with the one-time Tdap booster dose, especially those who care for infants.
Really just got some great information from Dr. Noodles. One thing we didn't really cover is who gets pertussis, who gets whooping cough. Everyone is at risk for pertussis, but it's most severe for babies. More than half of infants younger than 1 year old of age who get the disease are hospitalized. Of infants who are hospitalized with pertussis, 1 in 4 get pneumonia. 1 or 2 in 100 will have convulsions, and 1 or 2 in 100 will die.
Up to 5 in 100 adolescents and adults with pertussis are hospitalized. Of those patients, up to 2 in 100 are diagnosed with pneumonia. The most common complications in a study of adults with pertussis were
Weight loss, loss of bladder control, passing out, rib fractures from severe coughing.
The best way to prevent pertussis among infants, children, teens, and adults is to get vaccinated. Also, keep infants and other people at high risk for whooping cough complications away from infected people. One of the vaccines, DTaP, is for pediatric diphtheria, tetanus, and acellular pertussis.
Getting vaccinated with DTaP or Tdap, depending on your age, is especially important for pregnant women and anyone who's around infants. Remember that even fully vaccinated children and adults can get pertussis. Early symptoms of pertussis can last for 2 weeks and usually include runny nose, low-grade fever, mild occasional cough, apnea, a pause in breathing in infants. Treatment is just as important as the disease itself, and pertussis is generally treated with antibiotics, and early treatment is very important. Treatment may make your infection less severe if it started early, before coughing fits begin. Treatment can also help prevent spreading the disease to people who have spent a lot of time around the infected person. There are several antibodies available to treat pertussis. If you or your child is diagnosed with pertussis, your doctor will explain how to treat the infection. If your child is treated for pertussis at home, do not give cough medicine unless instructed by your doctor. Giving cough medicine probably will not help and is often not recommended for kids younger than 4 years old.
Facts to remember about pertussis are that it's a highly contagious respiratory disease. It's known for its uncontrollable, violent coughing, which often makes it hard to breathe. After fits of many coughs, someone with pertussis often needs to take deep breaths, which result in the whooping sound. Pertussis most commonly affects infants and young children and can be fatal, especially in babies less than 1 year of age. The best way to protect against pertussis is by immunization. If you or a loved one suspect having pertussis, you should contact your doctor immediately.